In this video, we will introduce visual evoked potential, an important EEG-based method which is used to study how the brain responds to visual stimuli. A visual evoked potential is a brain response triggered by a visual stimulus, like a flashing light or a pattern on the screen. It is recorded using EEG electrode placed on the scalp, especially over the occipital lobe, the part of the brain which is responsible for vision. During a visual evoked potential test, the participant sits comfortably looking at a screen where they are shown some flashes or checkerboard patterns. The electrodes that we are interested in are in the occipital lobe, as mentioned, especially OZ, O1, and O2. When a checkerboard pattern is used, the patients usually look at a screen which is placed around 1 meter away from the participants and looking at a specific point. And the patterns on white and black squares are reversed in a regular pattern and intervals. And these changes stimulates the visual system. The size of the square is usually around 9 millimeters, but this can be altered according to the test. So why we are using checkerboard patterns? Because of the high contrast, because of the sharp edges, and because it produces some reliable and repeatable responses. The stimulus is repeated, and several trials are averaged to average out noise and improve the signal. The key feature from the visual evoked potentials waveform is the P100 peak, which is a positive wave that appears around 100 milliseconds after the pattern reversal. A normal P100 indicates healthy visual pathways, while our reduced amplitude, altered amplitude, or some delay in the latency might indicate some issues, some problems in the visual pathways. So visual evoked potential is an EEG-based technique which is quick and non-invasive and is very useful to diagnose conditions or disorders affecting the visual system.